Acute low back pain is a musculoskeletal condition affecting upwards of 90% of adults during their lifespan, quite a substantial number. Although acute low back pain has an excellent prognosis, for some, injury will occur again and again, and with each recurrence, the risk of developing subacute and chronic low back pain increases. Chronic pain is associated with depression, anxiety, social withdrawal, increased disability, and medical comorbidities. The burden of chronic pain is immense. But we must remember, all chronic pain has originated from an acute low back pain episode that occurred at some point in time. So, why not try to intervene sooner, before acute low back pain becomes chronic? Practitioners frequently recommend physical therapy to patients with subacute and chronic low back pain, as evidence indicates it improves symptoms and restores function. For my PICO question, I asked, in adults presenting to primary care with acute low back pain, does early referral to physical therapy decrease the recurrence rate of acute low back pain and subsequent development of subacute and chronic low back pain? Unfortunately, the role of physical therapy for acute low back pain is unclear and therefore could not be recommended as a standard intervention. However, the evidence recommends practitioners conduct a thorough diagnostic triage to identify risk factors for developing chronic low back pain, referred to as yellow flags, and provide risk-stratified care. So, what is risk-stratified care? It means practitioners assess each patient, identify risk level, low, medium, or high, and provide treatment and make referrals, such as early physical therapy, based on that risk level. Risk factors for developing chronic low back pain, these are the yellow flags, include certain attitudes and beliefs about back pain, emotional concerns, compensation issues, social support issues, and others. The START back approach, START stands for Subgroups for Targeted Treatment, developed at Keele University, uses a simple screening tool that allows practitioners to quickly assess patients and provide treatment based on prognosis or risk of poor clinical outcomes. Implementation of this tool into practice is supported by the evidence. Studies have even reported discriminant validity of the tool as outstanding, with notable test-retest reliability. Based on this body of evidence, an intervention was created with the goal of enhancing knowledge of local primary care practitioners. Now, to give you some local context, I live in Elmira, Ontario, a rural community where agriculture and factory work represent the primary industries. As physical labor is a significant risk factor for low back pain, musculoskeletal injury and low back pain are a major concern, especially among working adults in my community. The intervention, which consists of an in-person education session, discusses current clinical practice guidelines, highlights the need for practitioners to consider prognostic clinical indicators, and introduces the START back screening tool, which is specifically designed for the primary care setting. The overall goal of implementing this evidence-based intervention is to ultimately decrease disability and time off work for patients affected by acute low back pain in the local community. I've provided some relevant links below. Thank you for listening, and I look forward to your questions and feedback.